Caloocan is presently classified as one of the country's highly urbanized cities. Rapid urbanization has transformed Caloocan from its latency to a realized city with commercial as well as trade investments and different thriving industries with vast income possibilities. Despite limited resources, health reforms were instituted, daycare and health centers were built, hospitals were enhanced and equipped, and more personnel were hired. True to form, in answer to the call of progress, a new form of governance emerged, one which is at par with the constituents' call for a more systematic and organized regulation. Caloocan City is currently implementing universal health care or kalusugang pangkalahatan through its dictum, health empowerment for the people, by the people, and through the people. With these, the following programs and projects addressing MDG 4, which is to reduce child mortality, MDG 5, improve maternal health, MDG 6, combat HIV/AIDS, malaria, and other diseases have come to fruition. Statistics also show that almost half of the deaths of Filipino children under 5 years old is within the first 28 days of life. Leading causes of neonatal death are prematurity, sepsis, and asphyxia. And this reflects the quality of prenatal care for pregnant women as well for the care of the newborn. For Millennium Development Goal 4 in 2012, the infant mortality rate is 24 in the national and 10 per 100,000 live births in the regional level. In Caloocan City, the infant mortality rate has decreased from 11 in 2005 to 8 in 2012. Newborn screening. Recognizing the need for financial assistance on various projects, the Caloocan Health Department partnered with Rotary Club International in funding newborn screening. Allocation for this project amounted to $10,000, which was used to buy NB newborn screening kits. This initial partnership brought forth the recognition of 100% newborn screening performance in Camarin and Deparo lying-ins. Nutrition Program. Partnering with NGOs. The Caloocan Health Department since 2006 have done numerous feeding programs to the identified malnourished school children in public schools. Lectures were done to their parents and their caregivers. Proper handling, preparation of food, and hand washing were taught as well. Simultaneous breastfeeding. Starting August 31 of 2010, simultaneous breastfeeding activities are done annually in District 1 and 2 areas. Target clients are 1,000 breastfeeding mothers who will breastfeed their children at the same hour. This serves as a strategy to advocate the importance of breastfeeding for nutrition and bonding of mother with child. Breast milk donation and breast milk stations. In partnership with Fabelia Hospital, breast milk are donated by lactating mothers for use of premature babies and other babies in need of breast milk. These donated breast milk were stored and banked for use. A breast milk station was also put up at the Caloocan Health Department for City Hall employees who would like to breastfeed or use breast pumps for milk storage. Children's Congress. In recognition of the special needs of children and the protection of children's right to health, education, and better life, the Caloocan Health Department started the Children's Congress in Caloocan on February 28, 2011. This annual event aims to educate people on child welfare and well-being. Oral care sa daycare. This project aims to promote dental care and hygiene to preschoolers in public daycare centers. Children were given dental kits with toothpaste and toothbrushes. They were instructed on proper toothbrushing and oral care. Our country is one of the 68 countries which contributed to 97% of maternal neonatal and child deaths worldwide. In the Philippines, 160 women die for every 100,000 live births. 7 out of 10 deaths occur during childbirth or within 1 day of delivery. Sadly, 4 out of 10 deaths are preventable. For Millennium Development Goal 5 in 2012, the national accomplishment is 71 and 14 per 100,000 live births in the regional level. In Caloocan City, the mortality rate has decreased from 21 to 1 during the 7-year period from 2005 to 2012. KKK, Kumare, Kumadrona at Kaligtasan sa Panganganak, Safe Motherhood Project. Each pregnant woman is assigned to a partner Kumare who is trained on prenatal and postnatal care. The Kumare makes sure that 4 prenatal visits are done, oral care and tetanus toxoid given, delivery at lying-in or any health facility, and exclusive breastfeeding are advocated. Buntis Congress. Conducted annually since 2006, this program aims to educate pregnant mothers on the importance of natal and postnatal care, breastfeeding, and care of newborns. This project covers 500 pregnant women who were actively sought after and continually monitored by partner midwives. Lectures are conducted by experts on various fields, and mothers are given souvenir packs and IEC materials on health programs. Men's Congress. Cognizant of the roles of men as partners in reproductive health, this program was launched simultaneously with Buntis Congress. Lectures are given highlighting the importance of men in health planning of their families. Capacity enhancement training programs for practicing midwives on maternal and newborn care. This project is partnered with Philippine Obstetrical and Gynecological Society and OB gynecologists of both LGU and DOH retained hospitals. Practicing midwives in Caloocan cities were trained for skills enhancement in birth delivery and newborn care. Referrals for high-risk birth was emphasized. Laban ni Maria. In its fight against cervical cancer, the Caloocan Health Department gave free cervical screening and vaccination for women of reproductive health. Launched in May 30, 2011, this project is a yearly activity with resource allocations coming from NGO partners. Annual Maternal and Child Conference. This activity aims to create a firm working relationship with practicing midwives to teach them the proper maternal care in coordination with Caloocan Health Department and the establishment of a strong referral network among them and the healthcare professionals. Maternal and neonatal death review. In line with the goal of reaching MDG 5, the Caloocan Health Department initiated this annual event in cooperation with physicians, midwives, and maternal program coordinators. Each reported maternal death are reviewed and investigated. Each steps in natal care and postpartum care scrutinized so that control measures and interventions can be properly done. Public-private partnership for family planning and maternal and child health. Public-private partnership with key stakeholders in the Caloocan City, such as industrials, companies, and workplaces, along with the Department of Labor and Employment and PRISM, were established to promote family planning and reproductive health. The Philippines ranks 9th on the list of 22 high-burden tuberculosis countries in the world. After China, it had the second highest number of cases in the Western Pacific region in 2007, and TB is the 6th greatest cause of morbidity and mortality in the country. In 2007, approximately 100 Filipinos died each day from the disease. The TB treatment success rate for Caloocan City increased from 71% in 2009 to 79% in 2011. For HIV, according to the 2008 National Demographic Health Survey, almost all women, 94%, have heard of AIDS. However, knowledge of HIV prevention method is lower. Only 53% of women aged 15 to 49 know that HIV can be prevented by using condoms and by limiting sex to one faithful partner. In Caloocan City, the number of population aged 15 to 25 years old recorded to have HIV went down from 1.14 in 2010 to 0.9 in 2012. Magkasama tayo sa muling pagbabago, lakas laban sa HIV/AIDS in Barangays 143 and 144, Bagong Barrio, Caloocan City. Alarmed by the increasing number of HIV cases affecting the 15 to 24 years old, several organizations came together to launch an advocacy. Reality mapping was done in 2 barangays and peer-to-peer education program designed for men having sex with men and most at-risk young people whose ages range from 15 to 24 years old was conceptualized. And this started the birth of SINAG, sandigan at inspirasyon na aagapay sa positibong gawain ng kabataan. TB task forces to ensure that proper case finding and holding were done for TB patients. TB task forces are formed in all health centers. These are comprised of barangay health workers and volunteer treatment partners. Proper documentation and monitoring ensures treatment compliance so that TB patients will not be lost to follow-up. PhilHealth promotion. In line with the thrust of universal coverage for the poor, the Caloocan Health Department secured accreditation of all 46 health centers in the city. Health Information System Development. The workshop series on epidemiology information management and analysis strengthened the Caloocan Health Department data collection, encoding, analysis, and interpretation of data. Program coordinators and their partners are taught the basic of epi-info encoding so that transfer and recording of data are done electronically. The computerization of 46 health centers started by the provision of computers and internet connectivity. The implemented interventions led the Caloocan Health Department to enhance health services to the community, as evidenced by the improved reported statistics and data on variables reflected in the LGU scorecard. And these were also supported by the awards, recognitions, and appreciations received by Caloocan Health Department. Health reform strategies towards the culmination to the Aquino Health Agenda are just but a reflection of the need for effectiveness and equality on health system reforms. Health initiatives instituted by the Caloocan Health Department with the support of the local government has tried to answer the call for a more structured, systematic, and responsive health system. Healthcare was basically awakened and revitalized to suit the emerging needs of the populace. Gaps identified in the performance analysis of programs have been narrowed through interventions specifically addressing priority issues. Through this, the Caloocan Health Department became a dynamic, proactive force, persistently and constantly striving to achieve universal health care for all citizens of Caloocan. To ensure the realization and fulfillment of our goal, we support our mission, we affirm our vision, and we declare our commitment, a united Caloocan towards health, wellness, and better life.